know what she said, she might just change your life.
I'm Sharon Caddy in studio this morning with Christine Bentley. We're so glad you are along with us, and we are welcoming to studio Dr. Yair Lenga, who is a periodontist, and we're here to talk about, boy, when it comes to teeth, this is something everybody can relate to and needs to know more about.
Well, periodontal disease, gum disease, is far more prevalent than we think. And we've actually talked to somebody about what you can do if you're going through chemo, and because that impacts, all those things impact. It's like your nails, your hair, your gums. We should let you do that.
You should talk about this.
I mean, this is your subject, but expectant mothers who obviously, all the nutrition, I always think of when you're pregnant, your baby is getting the good stuff, so you need to be careful.
Well, it's interesting that you said that this is an issue that a lot of people don't talk about and that it's far more prevalent than we understand. About 30% of the population from cradle to grave have some issues with their periodontal health. Past weekend I was talking about expecting mothers and what they can expect from their gums during pregnancy, and also about their children from the time that they're born up until the end in terms of changing from baby teeth to adult teeth, all the issues that can happen around the gums and the teeth. And it's something that we don't ever feel. It's like heart disease or osteoporosis. We know that it's happening, but we don't actually feel it's happening unless someone is investigating it. So how do we get these people to start investigating and looking into their gum health and into their tooth health? This is the big obstacle.
Well, it seems so far removed, though, the gums, from all these other functions in our body. It really came front of mind to me after having a hip replaced, and I take antibiotics every time I get treated with my teeth now.
Yeah, for the next 2 years, I believe, right?
Yeah.
It's amazing, just the connection between oral health and systemic health. And this is something that, I come from a long line of doctors and family members and my brothers, my sisters, they're all in the emergency room. And when there's an issue with their teeth, they will call me up from the emergency room and say, "Help, can you help me?" Because they don't actually learn enough about the connection between oral health and systemic health.
Okay, so we're talking about pregnant women. What do they need to watch out for? What are the signs? What can they do?
Well, the biggest myth that I think most pregnant women have is that they have to postpone all of their dental work until after they deliver. And this is completely wrong. They need to actually be more vigilant and start coming into the dentist more often. The changes in their hormone balance, the changes that are happening with their skin, it all affects the teeth and the health around their teeth. And so that they find that they're actually more prone to getting gingivitis, red, irritated, angry gums. A lot of pregnant women will say, "God, I noticed that my teeth were hurting more, that we saw more bleeding around my teeth every time I brushed." But getting them into the dental office to investigate, well, is this just gingivitis or is it more serious? Do we have infections around the teeth? Do we have breakdown of the bone and the ligament that's holding these teeth in? That's really where getting these patients in, investigating them, and finding out what's going on is so critical and so important.
Where do you think pregnant women got the idea that they couldn't go in and have their teeth looked at or anything done?
I think it actually started from the dentists themselves. When they have a pregnant woman in the chair, there's a lot of anxiety about how to treat and should we be treating, and so a lot of dental treatment actually gets postponed until after the child is born. But in fact, when we look at things like taking dental x-rays during pregnancy, there really is no adverse risk to the baby or even to the mother during these periods of time, so we need to be more vigilant.
Yeah, well, I would see, Sharon, wouldn't you have thought that, yes, during pregnancy, and then I would have thought, and then when I'm breastfeeding, I don't want to, because everything that is happening to my body is going straight through the milk to my baby, so that would be essentially about 18 months that I wouldn't, that you're kind of off the market.
You're absolutely right. I see so many women that have actually neglected their oral health, and they come to see me, say, when the child is 1 or 2 years old, and suddenly there's massive breakdown, there's recession, and nobody was monitoring this during the period. Now, one of the biggest things is actually, like you said, during breastfeeding. Breast milk has tons of calcium in it and needs to have a lot of calcium in it. Do we know that the mother's getting enough calcium in her diet to actually make a healthy, nutritious breast milk? And we can see changes around the bone that support the teeth when a mother is not getting enough calcium.
It leaches off of that then if it's not present?
Exactly. If there's not enough blood levels of calcium, the body will actually maintain homeostasis by finding calcium in other places. The easiest place to get calcium from is bone that supports the teeth. So if we're seeing these patients, if we're seeing mothers who are expecting mothers and mothers who are breastfeeding, and we start to see, wow, your teeth are getting loose. We're starting to see changes on x-rays. The pockets are getting deeper. Wait, what's going on here? Let's get you to your doctor. Let's get a blood test going. Are you getting enough calcium in your diet? For a lot of expecting mothers, actually milk products can trigger that morning sickness. And if that's the trigger, they're going to avoid it.
Right, of course.
Wow. It's funny. You and I have both been pregnant, and
Oh, yeah.
I never even thought about that.
No, but it's funny you mentioned about teeth getting. I was with the first one. I noticed my teeth feeling like they were looser, and there's part of my brain going, "Oh man, this is that pregnancy brain they talk about. This is all weird and it's not real, but it is, isn't it?"
Absolutely. And actually, one of my staff members, her younger sister, just gave birth to a baby boy this weekend. And we were talking at the hospital, so everyone was very excited. And she said, my teeth were killing. I had these little swollen areas around my gums, and no one told me what to expect. And no one told me that it was okay to see the dentist. And here I am laughing because her sister is actually in the dental field and didn't communicate this to her. And we see things like advanced infections, little nodules. It's a horrible term, but it's sort of antiquated literature, but they're called pregnancy tumors, which I think scare the bejeebers out of most mothers. But what it is it's just a collection of pus, very angry, but it's a little collection that you find between the teeth that happens very commonly in pregnant women.
So let me ask you, so your advice would be to absolutely consult with your dentist and your periodontist all the way through. Watch your teeth like a hawk the minute you get pregnant,
Absolutely.
right? Let's go fast forward. You have a baby. When should we start to look at our children and periodontal disease? Because they get their little teeth in and then they lose their little teeth, and we take them to the dentist here and there, but do children get gingivitis?
Well, absolutely. We actually see very high incidences of gingivitis around the baby teeth. Now, these things thankfully change as the teeth go from infant teeth to the adult teeth. So it's not as big of a concern, but one of the major issues is actually acclimating people to the dentist. And so bringing a baby for regular hygiene checks and for regular cleanings is so important to get children more comfortable at the dental office with the whole process of having instruments in the mouth, counting the teeth, looking at the teeth and cleaning them. That's really sort of the goal early on.
When is the earliest you've seen gingivitis or bone deterioration in a child?
I've seen it right when those first two teeth are coming into the mouth, so
Well,
at
what-
6 months
Wow,
of
that's
age.
early.
Well, no, but
Bone
if
loss, yeah.
bone loss?
Absolutely, there are
But what-
conditions that happen in childhood that can actually signify that there's a systemic disorder happening, like hyperparathyroidism.
You do understand that we've got like thousands of mothers here who are having a panic attack.
I don't want to scare any parent, but I just want to sort of underscore that it's important to actually get the entire health team involved right away. We don't think twice about taking the baby to the pediatrician as soon as they're born. So why are we neglecting a lot of dental care that is happening right away?
So you're saying there are babies. Now I understand that I was warned when I had my babies not to let them, let's say, lie in bed with a bottle of milk because milk is full of sugar.
Absolutely.
However, is that periodontal disease reversible in a child?
So in children, most periodontal disease is reversible because the bone is growing so rapidly. All these minor issues that are happening early on, we can actually take advantage of the growth cycle. And what we want is these babies to see a pediatric dentist, and possibly early on, if we're seeing that some of the teeth are not growing in properly, to start seeing an orthodontist to see, well, is this a skeletal issue? Are they congenitally missing certain teeth? These are all questions that we don't necessarily know until we start investigating, counting the number of teeth. Some children have missing teeth and some children have extra teeth, and teeth that can sometimes grow together and fuse almost like twins, and some that can actually interfere with the normal growth of the adult teeth.
Now you mentioned a pediatric dentist. At what point is this something every family should seek out pediatric dentist, or do you start with your family dentist and go from there?
I think you start with your family dentist and you really understand how the child is starting to acclimate and feel comfortable with the dentist. There are a tremendous number of family dentists who are unbelievably skilled with young children and can really handle the needs of those patients.
Well, I had a horrible dentist in my childhood from London, England, who basically, it was just be quiet and sit there and I don't want to hear any whining. And I went to a lot of trouble with my family dentist was fabulous with kids. And I brought them in a lot because I wanted them to, and they go in now, if they even have a filling, they don't even get a needle, they get nothing. They're
It's
so
comfortable.
relaxed, whereas me, I need gas. I'm so tense. Because it never goes away as a child.
Can I tell you, I'm exactly the same way. I cannot sit through an entire dental cleaning. I'm petrified.
No,
had
I
some
don't
bad
get gas
experiences.
for cleaning. But,
Oh, I'm asleep for everything.
no, but they will go and have a tooth filled without anything.
Yeah.
Not even a
But
a
you'll
needle.
see dentistry has changed so much. There's a huge emphasis on the psychology around it, and you see the newer dentists coming out really paying attention to the entire body, the entire psyche around going to the dentist.
And also their
accepting
bedside
treatment.
manner.
It's just a better experience all around. 'Cause
Yeah.
I mean, I think all of us of a certain age group have some pretty nasty memories of our trips to
Absolutely.
the dentist. Dreaded it. It would be on the calendar 6 months down the line, and for the entire 6 months, I was worried about that date. Now it's you have a dentist appointment. Oh, cool. It's a very,
I
very
love
different
my dentist.
headspace.
I love my periodontist.
I love hearing this.
I do, and my children love their dentist.
Yeah, we were just saying we have a connection through your
Yes,
periodontist.
yeah,
We
absolutely.
trained together, and that's
Yeah.
he was the inspiration of why I actually went into periodontics. And,
Well, he's a legend.
he is the we call him the godfather of perio in Canada.
in Canada, and well, you can tell everybody his name.
So that's Howard Tenenbaum, who trained me, I should say, at Mount Sinai Hospital.
Well, and he is one of the humblest men on earth, but he has the distinct reputation of having saved a tooth for how many years? 20 years that was supposed to be pulled out. He just cannot pull out teeth.
Yep.
Like he will save a tooth
If
if
there's
it
a
takes.
single cell holding it in,
That's
he will make
amazing.
sure it lasts.
He's the guy you want. He's not about pulling out
Oh,
anything.
wow.
Anyway, this was so much fun and such great information. I hope that mothers or mothers, fathers, parents, grandparents out there pass the information along about it's never too soon
Absolutely.
to see a dentist or a periodontist.
And
And
we
if you're
encourage-
pregnant, if there's anything, it's not in your head, just go have it checked out.
Absolutely. We encourage everyone to share their stories and get more information on our website. We constantly put up information about how to care for your periodontal health.
And the
that's
website is?
www.stclairperio.ca.
Click the channel subscribe button for full-length interviews and more from What She Said here on YouTube.